I saw this lovely 22-year-old lady who had suffered for 20 years with postprandial pain. Uh, she had been worked up by psychiatrists and gastrointestinal specialists and had every test anyone listening can possibly imagine over 20 years' time. Every meal for her was painful. I asked her one question, which we're going to learn in this course how to ask properly and how to pursue the answer properly. One question: why still? It could have gone away. Theoretically, at least, it could have disappeared 10 years ago, 2 days ago, tomorrow. Why is it still here? And I know you don't know, just guess. The answer to the question was, after some contemplation, was all I can think of is vomiting. And as I pursued that, and I'll teach that in the course, how to do that. As I pursued that, it became clear that when she was 2 years old, she was told this by some adult. You were born with a cord wrapped around your neck, which of course no 2-year-old can understand. And if you had vomited, you might have died. And so think about it. A 2-year-old's misconception gets carried over for decades. She sees herself as, I'm a cord around their neck person. She doesn't understand the reality. And that vomiting will kill her. And so after each meal, she experiences intense esophageal spasm, tremendous pain with radiation to the back. The cure is simple, of course. It's reframing that understanding or misunderstanding and then guiding her to a more healthy solution, which is simply allow the food to pass through normally. That's the safest way to prevent vomiting. So there you have, a very simple cause, but one that 2 decades of examinations, doctors of all stripes, could not uncover because they didn't have the lever, they didn't know the question.